Well, recently, Dr. Shah from Beautologie contacted us regarding our skin segment and said that they have a product they believe can help your skin. So I'm taking off the makeup to be the guinea pig, and I plan to let you know how it turns out. We're at Beautologie with Dr. Milan Shah, and we're talking about their prescription strength skincare line. And the reason why I'm appearing to you sans makeup today is because I'm the test subject. I've got a lot of the skin conditions that a lot of you have told me about, the dark spots, the hyperpigmentation, the wrinkles, all of it. So I'm going to give it a try, and then we'll see where we are in a couple of weeks. But first, before we start that, all right, give me the bad news. What's wrong with me?
Well, thanks for coming in today, Amity.
Of
We
course.
really appreciate that. The Beautologie system actually does do quite a bit, and we do have a lot of laser treatments that are very effective to go after pigmentation, pores, fine lines and wrinkles. But before we get there, we can do quite a bit with just this system alone. Looking at your skin, there is a little bit of hyperpigmentation. You have some of that blotchiness. It could be from having kids, or it could just be from the accumulated sun damage in your youth. We can get rid of a lot of that pigmentation just by exfoliating the skin.
Okay.
Our system, the Beautologie system, has a few key components in it. It has prescription-grade retin-A, glycolic and lactic acids, and it also actually has what's referred to as bleaching cream. And even though we're not really bleaching your skin, what we're really doing is relaxing pigment cells in your skin. By just using this system, we're going to get rid of a lot of that pigmentation.
So, okay, so there's a foaming cleanser, but
it's this one right over here, the one that's called Vanish.
Okay, and that is going to get rid of my dark spots?
It's going to put a big dent into it.
Okay.
We have cells in our skin called melanocytes, or melanin-producing cells. They make a lot of pigment, and when they're hyperactive, you get blotchiness, you get sunspots, you get melasma, which is the hormonal pigmentation. Well, this is going to go to those melanin-producing cells and tell them to relax, stop making so much pigment, and thereby it's going to lighten a lot of that dark, those dark spots.
Now, this is something, I mean, a lot of people aren't ready to go under the knife. They're not ready to go into the laser. This is something you really think is effective? Because I got to be honest, I have bought pretty much every cream moisturizer on the market, and it hasn't worked for me.
Absolutely. Well, there's a lot of different things out there, things that are sold, over the counter, in the mall, and they promise a lot. The big buzzword is anti-aging. In reality, a lot of those creams, they don't really have anything that is really effective. They might have a drop of maybe the glycolic acid or a drop of retin-A, but really just a lot of moisturizer, which really isn't doing very much for the skin. This is tried and true stuff. Bleaching cream, retin-A, glycolic and lactic acids, they've been used for many, many years. This is stuff that's not only been used on a large population of patients, but actually tested in the lab, and we know this is effective. We've put it together in a system, a stepwise system that really targets specific layers in the skin. And yes, it is very effective.
And you developed this. This is something that doesn't come from a manufacturer that you buy. You actually developed this?
Right. We put together this system about 7-8 years ago. We've used compounding pharmacists and just our research on what the skin does and what specific skin conditions are, and we figured out the way to go after it, again, in a stepwise approach. And it's very, very effective. We have over 2,000 clients that are on this system right now, and we have tremendous results.
That's amazing. Okay, so for me, I know there's a lot of steps that I have to take, but how long using this would I start to see some results? Because it gets tiring after 6 weeks saying, I don't see anything.
Right. So the beauty of this is it's going to start working right away. In fact, in the first couple weeks, you're already going to start to see the old skin starting to come off and the new skin coming out in its place. And so what is that going to help out with? Well, we're going to get some great pore closure. It's going to start helping out with some finer lines and wrinkles. And it's going to improve what I call the hills and valleys of the skin, the pores together with those little bumps in the skin called sebaceous hyperplasia or clogged oil glands.
I have those. I have those.
Yeah, and it's going to help tremendously with that. Within the first couple weeks, it's going to start to work. Within a month, you're going to see some good results. Within 2 months, you're going to see wonderful results. The system itself is a 4.5-month process, and so 4.5 months to see the full effect of it. But again, you don't have to wait that long to start to see some good results.
Now, a lot of people will turn to something like this or turn away from anything at all because of financial concerns. Is this something that's more financially attainable than, say, laser surgery or something on that line?
Absolutely. Your investment into this is not anymore, actually tremendously less than a deep laser. It's actually equivalent to just one photofacial laser, as we call it. So a very minimal investment with wonderful rewards, what I think can get you the results of multiple laser treatments. And so it's a lot more affordable than clients would think.
All right, well, I'm going to start this coming up this week, and then we're going to start to show you the results coming up in a couple of weeks. But if someone wants to find out more information right now, how do they do that?
All they have to do is either go to our website, www.beautologie.com, or they could call us here at the office. Our number is 327-3800. The consultations are completely complimentary. What we want to do is, just like with you, Amity, look at the patient's skin, make sure they're a good candidate for this treatment, and if they are, we could get them started that same day.
Perfect. Thanks so much for talking to me about this. We'll see how this goes, and we really appreciate it. But we're going to send you to break right now, but before we do, we're going to give you a look at the pollen count in your area. Actually, before we do that, we got some teases for you. Also, I'll try anything. You let me know what you want me to try, I'll do it. I'm not afraid. And I'll let you know how that turns out. First, you might want to hit the unlike button for the story we've got for you coming up. How Facebook is saving face after what some consider an insensitive move. And California once again leading the charge in protecting California's working class, but it could mean bad news for small businesses. We'll have the latest on a new sick leave legislation. But first, now here's a look at the pollen count in the South Valley. Eyewitness News Health Alert continues right after this.